A 28-year-old woman comes to the physician for a 1-week history of shoulder pain. She has been moving into a new office at work and started feeling soreness after placing several items on a high shelf. The patient is asked to abduct her arm to the side with her thumb facing downwards and has difficulty resisting when the physician applies downward pressure on the arm. Which of the following muscles is most likely injured in this patient? Choice A, subscapularis. Choice B, supraspinatus. Choice C, infraspinatus. Choice D, teres major. Choice E, teres minor. Choice F, trapezius. Or choice G, pectoralis minor. I'll wait 5 seconds and answer the question. This is a rotator cuff question. You of course want to know your rotator cuff muscles, which is sits, subscapularis infraspinatus, teres minor, and supraspinatus. In this particular case, I gave you a pretty easy question because I gave you 2 identifying things here. This injury from reaching up a lot, like putting stuff on a shelf, and this weakness when this patient is trying to maintain the abduction of the arm while it's abducted to the side like this, called the empty can test. Both of these indicate injury or weakness in abduction, which is associated with choice B, supraspinatus injury. Now, here's the thing about the rotator cuff, okay? Some of you will just memorize a list of what the actions are and what the injuries sound like. You can do that. Now, that's a perfectly fine way of doing it. I'm going to throw up an image of the anatomy here. And for me, I always like to visualize it because once you know anatomically where the rotator cuff muscles are, it actually makes intuitive sense. So looking at this image and even just thinking about the scapula inside your body. So you have an anterior view, which is where you see mostly the subscapularis. For the most part, when I think anterior of the scapula with the rotator cuff, I'm thinking subscapularis. And then in the posterior view, you have the scapular spine separating you between the supraspinatus, which is above the spine, and the infraspinatus / teres minor, which are below the spine. Now, once you've separated the scapula into those 3 sections with the corresponding muscles. So first we have the front with the subscapularis. So if you imagine that muscle contracting, what does it look like it does? Well, it looks like it would kind of pull on the humerus and then rotate it internally towards it. So that's exactly what the subscapularis does. It does internal rotation. And it's the only one it makes sense for because the other rotator cuff muscles are mostly posterior. You can't internally rotate by contracting a muscle in the posterior of your body. That doesn't even make sense. So subscapularis, internal rotation. And if you wanted to test it, you would use the lift-off test, where you place the patient's hand on their back, usually their lower back, and then you ask them to lift the hand away from their back. And in order to do that action, you would have to rotate your humerus, right? So that's how you test for a subscapularis injury. All right, so now let's look at the 3 posterior muscles. Well, like I said, you could separate it out into 2 groups. You have the supraspinatus, which is above the spine, and then you have the infraspinatus plus teres minor, which are below the spine. Now, if you imagine the supraspinatus above the scapular spine with a tendon extending outward to the humerus, if that was to contract, what would it do to the humerus? Well, it would kind of lift the humerus up, right? But since it's at that angle, it's kind of lifting it diagonally, which is to say it's abducting the humerus, right? So yes, that's what the supraspinatus does, is abducts the humerus. And you need to do a whole lot of abduction if you're trying to arrange stuff on top of a shelf or something. So that's why they like asking that kind of question with supraspinatus injuries. And as was already outlined in this question, you do an empty can test, which is where basically you're just making the patient try to abduct their arm against your force, right? And then finally, with the infraspinatus plus teres minor, they're both coming at the humerus from below the scapular spine, from the posterior of the scapula. So it attaches to the humerus on the posterior, and if they contracted, they would kind of pull it towards it. So you would externally rotate that humerus, right? So that's what they do. They externally rotate the humerus. So you test this by doing the hornblower sign, which is where you abduct the arm 90 degrees, and then you bend the elbow, which is just something to make it more visible. Then you put downward pressure on the arm while asking them to externally rotate that arm. So it's almost like the patient is trying to rotate the arm externally upward so that they can hold an imaginary horn to the side of their face so that they can blow into it. That's why it's called the hornblower sign. Now, like I said, some of you are just going to go memorize the list or the sits mnemonic for your rotator cuff. But hopefully for some of you who have trouble with that, if you just visualize the rotator cuff muscles like I told you, it actually makes these questions really easy. And remember, your body is a reference, right? Unless you're missing both your arms and both your scapulas, in which case I'm really sorry to hear that. But for me personally, I feel like visualizing these things makes it much easier. So anyway, that helps us get through choices A, B, C, and E, because those are the rotator cuff muscles. Let's clean up the rest of these. Choice D, teres major. This is mostly an accessory muscle. You just want to know that the teres major is not a rotator cuff muscle. It's really not an important muscle. Maybe you can be aware that the teres major forms the inferior border of the triangular space where the circumflex scapular artery passes through, but that's very unlikely to come up. Super nitpicky stuff. Choice F, trapezius. Again, not an important muscle. Elevates the scapula, retracts it, rotates it. It's used to help you shrug, so you would use that to test its strength. Choice G, pectoralis minor. Again, not an important muscle as far as USMLE is concerned. It kind of keeps your scapula forward, but because it typically doesn't cause any very specific symptoms if it's injured, it's kind of hard to test on. So bring it back, rotator cuff. I mean, that's pretty basic anatomical stuff. Sits, subscapularis, infraspinatus, teres minor, supraspinatus. Subscapularis is at the anterior of the scapula. It internally rotates the arm, opposed by the teres minor, and infraspinatus below the scapular spine on the posterior, which will externally rotate the arm. And then you have the supraspinatus above the scapular spine, which helps to abduct the arm. First 10 degrees. After that, it's deltoid. Hope you found this video helpful. I'll see you in the next one.